Hello, my name is Casey Martinez, and I am recording a head-to-toe assessment for the Florida Gateway College BSN program. So I'm going to start by coming into the room and closing the door for privacy, which I have already done. And then I am going to go ahead and do hand hygiene. Once my hand hygiene is completed, I will go ahead and put some gloves on. Okay, and I'm going to start by introducing myself to the patient. Hello, my name is Casey. I'll be your nurse today.
Hello.
What is your name?
Isaiah Martinez.
And your date of birth?
5/21/1997.
Perfect. Do you know where you are today?
The health clinic.
Okay. And what are you here for today?
My checkup.
Perfect. Do you know what year it is?
2023.
Awesome. Do you know what month it is?
February.
And do you know who the president is?
Joe Biden.
Perfect. Do you have any allergies?
Penicillin.
All right. And how long have you had this allergy?
Since birth.
And what is the reaction whenever you take the penicillin?
I believe I break out in hives.
Okay, perfect. And what is your height today?
5'8".
All the time. And what is your weight?
185.
Are you on any current medications that you take daily?
No.
Okay. Is there any pertinent family history that I need to know today before starting your head-to-toe assessment?
Just a history of diabetes from my paternal grandmother.
Okay.
Not sure what type.
When was the last time that you had a health visit?
Over a year ago.
And what was your visit for?
Same thing. Checkup.
Okay, perfect. Is there anything about your health history that I need to know today before I begin the assessment?
No. I have had minor surgery on my mouth, but that's it. It was just removing 3 teeth.
Okay.
So.
And that was when you were how old?
I believe I was 13 when that happened.
Okay. So I'm going to go ahead and start your head-to-toe assessment. So what I'm going to do is I'm going to start by just palpating, which means feeling your head, looking around for anything that might be abnormal. So we'll go ahead and start that. You tell me if you feel any pain. All right. And I do feel a mountain-like area here, about 3 inches long and about 2 inches wide. Do you know what happened there on your skull?
Yes, when I was 11 years old, a 6-foot piece of a tree landed directly on top of my head.
Okay, and do you have any complications from that now?
No, just sometimes it hurts when it rains.
Okay, perfect. So I'm going to go ahead and inspect your ears. Actually, before I do that, I'm going to go ahead and do your vital signs really quick.
Okay.
So I will take your temperature. 97.8. And I will take your oxygen. And that's 97. Perfect. And let's do your blood pressure. All right. (124/76), which is normal. I also counted your respirations while that was going, and they were 16. Okay. And your pulse is 76, which is normal. All right. Now I'm going to go ahead and get back to the assessment, and I'm going to start off at your ears where I left off. So I'm just going to take a little look-see around your ears, making sure that there's no lesions. It looks, your ears look normal. They're nice and pink on the inside and moist as they should be. That one is, and this one as well. I don't see any scars or lesions anywhere around that. Do you wear any hearing aids?
No.
Okay, perfect. So I'm going to go ahead and take my pen light and I'm going to turn it on. I'm going to have you look at my nose while I shine the light in each eye to check for your pupillary response. So go ahead and take a look at my nose. Left side. Right side. Perfect. All right. And your conjunctiva looks pink. Your sclera looks white, which is completely normal. Are you having any drainage from your eyes?
Nope.
Any pain?
Nope.
Okay, perfect. I'm going to go ahead and have you raise your eyebrows for me. Perfect. You can put them down. And then if you will puff your cheeks out. Perfect. And then go ahead and smile for me. All right. And I don't see any unequal in any of that. So he is not having any weakness on either side of the face. I'm going to look inside your nose just to make sure that everything is nice and pink and there's no deviations in there. Perfect. Everything is moist and pink. I don't see any deviated septum. Your nose is midline, which is normal. So I'm now going to go ahead and feel your lymph nodes. So you tell me if any of this hurts. And I can feel that trachea is midline, and I can not feel the thyroid, which is normal. I'm going to go ahead and assess the back of your neck. I don't see any discoloration, no ecchymosis, which is bruising, and I also don't see any scarring. Okay, so I'm going to go ahead now and just feel around the chest area, and you tell me if you have any pain, okay?
Mm-hmm.
Any pain with any of that?
Nope.
All right, perfect. So I'm gonna go ahead and listen to your lung sounds in the front. You'll take a deep breath. Out. In. And out. Perfect. Awesome. Just two more. Perfect. All right. So I don't hear any I don't hear any bronchi. I don't hear any other kind of abnormal lung sounds. Both lungs sound like they inflate symmetrically. So there is no deflation of one lung or the other. I do notice that your chest upon assessment rises equally on both sides. So that's good. So now what I'm going to do is I'm going to go ahead and listen to your heart. So I'll listen to the 4 different regions. So it's going to be apical, pulmonic, Erb's point, and mitral. The mitral is actually the apical, and I meant to say aorta at first. So aorta, pulmonic, Erb's point, mitral. And I'll listen to the mitral for 60 seconds just to make sure that there is no murmurs, gallops, rubs in your heart. Okay. So this one's the apical. Pulmonic. Erb's point. Mitral. All right, perfect. So I don't hear anything that's abnormal there. And I'm going to go ahead and look at your arms. So if you will, please just lift your arms straight up for me, straight out. Perfect. And we don't see any drift. So one side is not weaker than the other, which is good. I don't see any ecchymosis, which is bruising or scarring on his arms. I don't see any nodules or lesions on either arm here. So that looks good. And so I'm going to go ahead and test his capillary refill. And that is when you squeeze the tip of the fingers, you just want the blood return to be less than 3 seconds back into that finger. So we'll do each finger. Good, 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 good. Awesome. All right. Let's see. And he does have a less than 3 second return in all of his fingers. So that is good. So now what I'm going to do is I am going to have him do a neuro check with his arms. So if you'll put your arms out again for me, and I want you to push against me. Perfect. Push against me. Awesome. Put your hands out and push against me. Pull against me. Awesome. So now I'm going to feel his arteries on his arms. So this is the radial. And it's perfect. It's +2. I'm going to feel this brachial. That is also +2. And then I have one here. And that is +2 as well. So I'm going to go ahead and do the other side. +2. +2. Perfect. Okay. So now we are going to go ahead and move over to the bed so that I can assess his abdomen and his legs. Okay, so what I'm going to do is I'm going to look first, then I'm going to palpate. Then I'm going to percuss, okay? Because we wouldn't want anything to get messed up by me palpating or percussing first. So we do this part a little bit different. So I'm going to go ahead and lift up his shirt just to hear some. And I noticed that there is some hair on his belly, which is fine. He does have his umbilicus here, and it doesn't look like he's distended anywhere on his belly. So I think that means it's okay for me to go ahead and palpate lightly first. So I want you to go ahead and just tell me if you feel any pain when I do this. So over on this side, you have your spleen. You have your gallbladder here. And your appendix. So, did any of those hurt?
Nope.
Okay, we're going to go a little bit deeper to feel the organs. Okay. And the organs don't feel like they're inflamed. They're not palpable, which is good. So now we're going to percuss and listen for tympani to see if we can hear if there is dull noises or if there is just the regular noise. If it's dull, then that means that that particular area of the organ could be swollen. Okay?
Mm-hmm.
All right, perfect. So are you having, can you go ahead and just tell me about your bowel movements? How often do you have a bowel movement?
Usually twice a day.
Okay. And you've been having bowel movements for twice a day for a long time, or is that just started? Okay.
For a while.
So it sounds like that's regular for you. And what is the color?
Just brown. I mean, it's not hard to push out or anything. It's just regular.
And it's formed?
Yeah.
Okay, perfect. Do you have any issues with urination? Like when you start the stream, do you feel like it takes a little bit to get the stream going, or does it immediately come?
No, I don't have any problem with it.
Okay, perfect. So what I'm going to do now is I'm going to feel your arteries in your legs, and then we'll move to the next step, okay? So there's an artery here. This is the I'll come back to what it's called in just a minute. This one's the popliteal. Perfect. It's 2+. And then I'm going to feel this dorsalis pediis. Perfect. Dorsalis pediis here. Perfect. And popliteal here. Awesome. And then this one again here. Perfect. Okay, so can you just wiggle your toes for me? Awesome. And can you feel me touching your foot?
Mm-hmm. Yep.
Okay, and again, these are called the femoral arteries here. Okay, so with your feet, I'm going to have you go ahead and push against me. Perfect, and push against me. Awesome. All right, and I'm going to check your capillary refill on each one of your toes. And everything looks good. Everything's coming back less than 3 seconds, which is exactly what we want. So now I'm going to do some range of motion with your legs, just to kind of test the strength and see where we're at. So just want you to lift this straight up. Perfect. And bend. Awesome. And straight. Perfect. So we're going to go up, bend, and straight down. Perfect. All right, so there's no weakness on either side. Both are strong and equal. So what we're going to do now is I'm going to have you come sit on the edge of the bed. And while we're here, I'm going to go ahead and listen to the back side of your lungs. All right. Deep breath. Perfect. 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 All right. And two more. And last one. All right. So I'm going to go ahead and feel in your back here, and I want you to tell me if any of this hurts. So I'm just going to palpate. None of this is hurting?
Nope.
Okay. And so now I'm going to percuss his back and see if any of that hurts. And we're specifically going to percuss his kidneys to make sure that there's no pain there. And that will help us know if there's any kind of kidney infection kind of starting or going on. Okay. Any pain there?
So there's a little bit of pain right here, but I think it's a workplace injury. It's the muscle. It's not any organs.
Okay, perfect. So I'll go ahead and come to your front side. So what we're going to do now is I'm going to test your deep tendon reflexes. So I'm going to take my hammer here.
Just the camera so they can see it.
And I am going to just hit your knee right in this area, and we'll see what happens, okay? Ready? Moved a little bit. Perfect. I know, it feels kind of weird, right?
Yeah.
Like your leg is dead.
Or like I can't, like someone else is controlling it.
Yeah.
Oh.
All right. Perfect. So we do notice that whenever we do the deep tendon reflexes, that it doesn't send cross signals, which is a good thing, which means that his deep tendon reflexes are normal and they are reactive. So that is perfect. I am going to go ahead really quick and test his sensation. Perfect. All right. So I'm going to have you close your eyes, and I'm going to touch you in different places with this Q-tip, with a hard side and a soft side. And I'm going to have you tell me if it's hard or soft and just touch wherever that I touch you so that I know that you felt it, okay?
Mm-hmm. Soft. Hard. Soft. Hard. I couldn't tell, but you touched me right there. With my shirt on, it's hard to tell. That's hard for sure.
Okay.
Which means that one was soft.
Perfect.
Right. Soft. Hard. Hard. Soft. Soft. Soft again. Hard. Soft.
All right, perfect. So now I'm going to do the finger to nose.
Okay.
So what that means is I am going to go ahead and have you touch one finger to your nose, and then the other one, we're going to repeat that a couple times. Perfect. Okay. Perfect. Perfect. All right, and so now we're going to go ahead and I'm going to have you follow this pen with your eyes. Okay, ready? Awesome. Great job. I'm going to go ahead and look at your ankles here to see if there's any edema. So I don't see any edema. Skin bounces right back, and that's perfect. When I touched his arms and hands, they were warm to the touch, and when I touched his legs and feet, they were also warm to the touch. His skin is the color of his cultural Puerto Rican, so that is normal. And now I'm going to have him go ahead and give us a walk so I can assess his gait. Do you ever have any balance issues, any falls in the past?
Nope.
Do you have anything that you need to tell me about your gait before we go ahead and start to try to walk?
Nope.
Okay, perfect. So what I'm going to have you do, I'm going to have you walk from that door to that wall and back. Perfect. All right. So that is the end of the head to toe assessment for Florida Gateway College BSN program. Again, my name is Casey Martinez. Thank you.